Welcome back, health explorers, to part 2 of our journey into nature's powerful pharmacy. In our last episode, we unveiled 6 incredible traditional Chinese medicine herbs offering solutions for joint pain and rheumatic discomfort. Today, we're diving even deeper, revealing 6 more extraordinary plants, each with a unique ability to bring comfort and healing. Get ready to expand your knowledge and discover even more natural pathways to well-being. Let's pick up right where we left off. First on our list for part 2 is large-leaf gentian root, known in TCM as Qinjiao. This remarkable herb, the dried root of various gentiana species, thrives in China's northern provinces like Heilongjiang and Inner Mongolia. It's harvested in late autumn, meticulously cleaned, sliced, and dried. Historically, Qinjiao was a versatile remedy for everything from rheumatism and fever to jaundice and even diarrhea. Today, its primary role is in treating rheumatic and rheumatoid arthritis, widespread body pain, and fevers. In terms of its TCM properties, Qinjiao has a bitter and acrid taste, and it's neutral in temperature. It precisely targets the stomach, liver, and gallbladder meridians, influencing vital energy pathways in your body. So, how does Qinjiao work its magic to relieve rheumatism? It's incredibly effective on its own as a decoction, but often shines when combined with other herbs. For those experiencing febrile syndromes, which involve inflammation and swollen joints throughout the body, it's often paired with Stephania, Lonicera stem, and phellodendron bark. If you're dealing with painful syndromes, it might join forces with prepared aconite, pubescent angelica, and cinnamon twig. For lower limb arthralgia, Qinjiao is a key ingredient in the famous Du Huo Jai Sheng Tang formula, alongside herbs like pubescent angelica, loranthus, and ginseng. And for chronic rheumatic arthritis, particularly the fixed type, it blends beautifully with kinemals and stephania. Beyond rheumatism, Qinjiao also excels at eliminating dampness and heat, making it a go-to for treating jaundice or hepatitis caused by those specific pathogenic factors. Furthermore, it plays a significant role in relieving paralysis and symptoms following a stroke. In a comprehensive formula called De Qinjiu Tang, Qinjiao is combined with a host of other powerful herbs like astragalus root, licorice root, Chinese angelica, and many more, to address facial palsy, paralysis, and hemiplegia. The typical dosage for Qinjiao is a decoction of 3 to 9 grams. However, a word of caution: if you experience frequent urination, diarrhea, or have a generally weak constitution, it's best to avoid or use this herb with extreme caution. While classical texts report no undesirable side effects at recommended doses, modern research indicates that even 100 mg of its active component, gentianine, administered 3 times daily, can cause severe nausea and vomiting. So precise dosing under professional guidance is crucial. From a modern research perspective, large-leaf gentian root contains glycosides like gentiopicroside, along with alkaloids such as gentianine. Pharmacological studies confirm its wide range of benefits. It's a sedative, antihistamine, and analgesic. It also boasts antimicrobial, antipyretic, anti-inflammatory, and antihypertensive properties. Truly a versatile healer. Next up, let's explore Cynanchum root, also known as swallowwort root. This dried root and rhizome originates from various provinces across China, harvested in summer and sun-dried. Traditionally, Cynanchum root was a trusted anodyne, pain reliever, sedative, cough suppressant, and diuretic, often used for arthralgia. Today, its applications are even broader. It's employed for post-surgical pain, nerve pain, abdominal pain, toothache, and various types of cancer pain, often in conjunction with other specialized herbs. Cynanchum root has a pungent taste and is warm in nature, acting on the liver, spleen, and stomach meridians. Its primary function is to expel pathogenic wind, promote the smooth flow of Qi life energy, and relieve pain. For generalized arthralgia, sore muscles, and painful joints, it can be used alone or combined with pubescent angelica root or Stephania root. For lower abdominal pain, it's often paired with Aucklandia root and Corydalus tuber. It's also a powerful ally for difficult and painful menstruation, combining with Chinese angelica root and cnidium. For a simple toothache, a decoction of cynantium root can be used both as a gargle and taken orally. Beyond pain relief, cynantium is also used for detoxification, invigorating blood circulation, and treating inflammation from insect and snake bites. For skin disorders like allergic dermatitis and psoriasis, it's remarkably effective at relieving itching. Dosage typically ranges from 3 to 10 grams in a decoction or 1.5 to 3 grams in powdered form for internal or external use. If you have a weak constitution, use this herb with caution and be mindful not to overcook it. Classical Chinese materia medica records no undesirable side effects at suggested doses. Modern research has identified components like glycosides and pianol in cynantium. Pharmacological studies confirm its sedative, hypnotic, anticonvulsive, analgesic, antipyretic, and antihypertensive effects. It's also antimicrobial against S. aureus and certain bacteria, and its decoction has shown corticotropic hormone-like anti-inflammatory action against rheumatic inflammation. Clinically, cynantium has demonstrated effectiveness across a wide range of conditions, from chronic bronchitis and mastitis to menstrual pain, toothaches, post-surgical pain, and various skin ailments like urticaria and psoriasis. A truly comprehensive pain and inflammation fighter. Next up, let's talk about quinomals, known as muguar. This herb is the dried ripe fruit of Quinomals speciosa, a tree originally from Central America but now cultivated widely in South China. Harvested in August, sliced, and sun-dried, Quinomals is a renowned anti-rheumatic herb, exceptionally effective at relieving numbness and pain in muscles and joints. It, too, is used to help manage cancer pain. Quinomals has a pungent taste and is warm in nature, acting on the liver, spleen, and stomach meridians. Its key effects include expelling dampness from the body, invigorating meridian circulation, soothing muscles and tendons, and relieving rheumatic pain and muscle spasms. It's commonly paired with Acanthopanax, clematis root, and Achiranthus for treating rheumatic pain, calf muscle spasms, limb soreness and pain, numbness and heaviness or swelling in the lower extremities. For arthralgia caused by wind dampness, it combines with atractylodes, and for wandering by syndrome pain caused by pathogenic wind, it teams up with Notopterygium, pubescent angelica, and Scylla. Beyond musculoskeletal issues, Quinomals is also excellent for relieving stomach cramps and diarrhea, especially those caused by cold dampness in the GI tract, often mixed with fresh ginger and evodia. It's also a good remedy for bloating and general indigestion. The typical dosage is a decoction of 5 to 10 grams. A precaution to note: if your pain is due to yin deficiency, use this herb with caution. No undesirable side effects have been reported at therapeutic doses in classical Chinese texts. Modern research reveals that Quinomals is rich in saponins, flavonoids, and organic acids like malic and citric acid, along with vitamin C. Pharmacologically, it's confirmed to be anti-inflammatory, anti-rheumatic, antispasmodic, and antiemetic, also acting as a stomachic. Intriguingly, studies also show it has immunologic effects, impacting spleen index and macrophage activity in mice, and even demonstrates antitumor properties against certain carcinoma and sarcoma cells. Fourth, let's explore Acanthopanax bark, also known as Wu Jia Pai. This herb is the dried root bark of Acanthopanax gracilis, primarily grown in provinces like Henan, Hebei, and Sichuan. Historically, it was used for rheumatism and general debility, often as a tincture or wine. It's considered similar to Loranthus, but is noted for being even more effective in treating muscle and joint pain. Acanthopanax bark has a pungent and bitter taste and is warm in nature, acting on the liver and kidney meridians. Its core function is to eliminate arthralgia and strengthen tendons and bones. For wind-cold damp by syndromes, arthritis, soreness and pain in the lower back and feet, and swelling and pain in the joints, it's frequently prepared as a medicated wine, with a popular patent medicine being Wu Jia Pai Jiu. For general pain in muscles, joints, and fibrositis, it can be combined with pubescent angelica, clematis root, and atractylodes. It also blends well with carthamus and loranthus for arthralgia and bone and muscle soreness. Furthermore, acanthopanax induces diuresis and relieves edema. It can be combined with poria and orange peel in a formula called Wu Jia Pai Yin for treating general edema, limb edema, and oliguria. A typical decoction dosage is 6 to 12 grams. If you have yin deficiency, use this herb with caution. Classical Chinese texts report no adverse effects at suggested doses. Modern research has identified sesamin, syringin, and various acids and vitamins in acanthopanax bark. Pharmacologically, it's confirmed to be analgesic, anti-inflammatory, anti-fatigue, and antimicrobial. It also boosts immunological functions, regulates endocrine secretion, especially thyroid and gonads, protects the liver, and increases bone marrow activity in producing blood cells. An impressive array of benefits. Penultimately, we have Lycopodium, or Shen Jin Cao. This herb is the entire plant of Lycopodium clavatum, found across northern, central, and southwestern China. Harvested in summer and dried, Lycopodium is a popular herb for arthralgia affecting muscles, tendons, and joints, and like many others on our list, is used to help relieve cancer pain. Lycopodium has a bitter taste and is warm in nature, acting on the liver, spleen, and kidney meridians. Its main role is to expel wind-cold pathogens and relieve rheumatism. For rheumatism, muscle and tendon pain, muscle numbness, leg stiffness, and difficulty with limb flexion and extension, or even hemiplegia, Lycopodium is often combined with pubescent angelica, quinomals, white peony root, and cinnamon twig. For leg muscle cramps, it can be blended with quinomals and elangium. For chronic rheumatic disorders, painful joints, or muscular numbness, it teams up with prepared rehmannia root, dipsacus, loranthus, and other herbs for effective pain relief. A unique external application for Lycopodium is for the severe pain of shingles, herpes zoster. The powdered, stir-baked herb can be mixed into a paste with sesame oil and applied externally. Dosage in a decoction is typically 9 to 15 grams, increasing to 30 grams for severe symptoms. Precautions include caution for those with anemia, excessive bleeding, and pregnant women. Classical texts report no adverse side effects or toxicity. Modern research has identified various alkaloids in Lycopodium, including lycopodine and clavatine. Pharmacological findings show it's antipyretic, antimicrobial, anti-inflammatory, and diuretic. It has also been observed to increase uterine and small intestine contraction in lab animals. Finally, let's talk about siege specia, also known as Zaixian Cao. This medicinal herb is the dried aerial parts of various siege specia species, mainly grown in China's Jiangsu, Sichuan, and Zhejiang provinces. Harvested in summer and dried, it can be used unprocessed or stir-baked with wine. Traditionally, it was used to improve appetite, relieve pain in wounds, for insect bites, and numbness in extremities. Today, siege specia is highly valued for treating arthralgia, wind-cold-damp by syndromes, and chronic back pain. Siege specia has a bitter taste and is cold in nature, acting on the liver, spleen, and kidney meridians. It is also considered slightly toxic. Its primary effect is to relieve symptoms of rheumatism, particularly febrile syndrome, which includes arthritis, lassitude, limb numbness, and pain in the legs and waist. It can be used alone, as a decoction, or combined with achiranthes, pubescent angelica root, and loranthus. Beyond rheumatism, siege specia is also prescribed for hypertension, often as a daily tea, sometimes with chrysanthemum and prunella, to relieve dizziness due to hyperactivity of liver yang. It also has detoxifying properties, used to counteract pyretic toxicity, urticaria, eczema, and other infections, often combined with wild chrysanthemum and dandelion. It can even treat neurasthenia and insomnia, either alone in tea or with other sedative herbs. Furthermore, siege specia is used for cerebral apoplexy and cerebral vascular disease, combining with carthamus, acanthopanax, and sila to treat hemiplegia and post-stroke syndromes. The dosage in a decoction is 6 to 12 grams, and its juice can be used externally for skin infections and inflammation. While generally safe, with prolonged oral administration at suggested doses, it is considered slightly toxic in classical texts, and large intravenous doses in mice have shown toxicity. Modern research reveals that siege specia contains alkaloids, darutosids, and various organic compounds. Pharmacologically, it is confirmed to be anti-inflammatory, antihypertensive, antipruritic, antirheumatic, and detoxifying. Clinically, a daily dose of siege specia decoction has been shown to significantly decrease both diastolic blood pressure and neurotic symptoms in hypertensive patients. And there you have it, 6 more incredible herbs from the treasury of traditional Chinese medicine. From the overall body pain relief of qin, jiao to the targeted muscle and joint support of acanthopanax and lycopodium, and the unique benefits of cynantium, quinomals, and siege specia, these plants offer powerful, natural solutions. If this deep dive has ignited a spark of hope in your heart, if it's offered a glimpse of a life with less pain and more vitality, please take a moment to like this video. Your support helps us share this invaluable wisdom with more people who need it. And if you found this information truly transformative, share it with friends, family, anyone battling discomfort. And of course, subscribe to join our growing community committed to exploring the deepest secrets of health and well-being. Remember, true healing is a journey, and you are not alone. Thank you for joining me on this exploration of nature's remedies. Until our next deep dive, stay strong, stay hopeful, and embrace the power of natural healing.